I came to PT school with having had this really profound experience in Romania and really knowing that I wanted to do some type of global health work. And so that was always in my mind through those 3 years of schooling. I just felt like, okay, now, I want to finish, and obviously I want to be a good clinician, but I really want to pursue global health work. And there wasn't a lot of opportunities at that time. I mean, there still aren't, but there are more now. But I wasn't encouraged. I'll say that. I had a lot of mentors who I respected deeply, but they were very much just more traditional, and felt like, you know what, you need to work in the United States. You need to get that full-time job and work for 3 years, and then maybe you can do this. And that's probably true for some people, but I just was very agitated and felt like, no, I've been working long enough, and I really want to pursue something in global health, which is within a couple of years, I did just that.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 94. Hi everyone, Omari Richards here. Thank you all so much for joining me. Be sure to subscribe if you have not subscribed as yet. Greatly helps the show. Be sure to leave a review. Be sure to follow me on Instagram at the PH Millennial. And if you'd like to support, you can go to thephmillennial.com/support. And also you can share this with a friend, because that way you can help someone else navigate the public health journey just a little bit better. And I will greatly appreciate that as a lot of support. I enjoyed today's episode a lot. It's my first episode with someone with their doctors of physical therapy. She had a doctor of physical therapy as well as her MPH. And I think her insights are great because she talked a lot about the DPT as well as the MPH, and then like her interest in global health and how she navigated all of that and starting her own LLC. Well, she co-founded an LLC, and hopefully we'll get her co-founder on the show in the near future as well. But I think there's some great insights in this episode, so I hope that you all take it in and enjoy. Today we have a public health professional with 10 plus years of experience and clinical expertise in women's and pelvic health and child health and development. She got her Bachelors of Biology at the University of Mary Washington. She then got her Master of Science and Doctor of Physical Therapy at the University of California, San Francisco, and got her Masters of Public Health at Johns Hopkins Bloomberg School of Public Health. She is the co-founder of Mama LLC and also recently started working as the Senior Manager of Medical Affairs at Renovia Incorporated. We have Dr. Laura Kaiser, DPT, MPH. Welcome to the show.
Thank you.
How are you doing, and how have you been coping during these times?
I'm doing well. I think I'm faring as well as anyone, given everything going on in the world.
Well, that's good to hear. I'm just excited, a little excited for this conversation. Like, as I was telling you earlier, you're the first doctor of physical therapy that I'm having on the show. And I think it's always awesome when we get people with an MPH, but then are also doing something else. And because I think students a lot of the times think, okay, MPH is the only path that I can do. But I think like just the skill sets that you get from the MPH and translating it to whether that's physical therapy or occupational therapy or whatever the case might be is very insightful. So I'm looking forward to hearing more about your story.
Great.
So how do you identify, and then tell us a little bit about your personal background?
Sure. So my pronouns are she, her, and hers. I'm kind of, I guess, on a personal level. I grew up in Baltimore, Maryland, so I'm an East Coast native. I now live out in California. This is my second time relocating out to California. So I've got a little bit of bi-coastal going on. And I guess personally, prior to launching into the my health career path, I was a dancer. I was a ballerina a long, long time ago, and that certainly informed a lot of my physical therapy training and things like that, and some of the clinical work that I did early in my career. Though happy to have found a solid career in clinical care and public health as well.
Okay, that's awesome. While you were doing dancing as a ballerina, did you like work a lot with physical therapists, or was that something that you were introduced to at an early age or anything like that?
I really didn't. Fortunately, I didn't have a lot of injuries when I was young, so I didn't get exposed to physical therapy. But we studied, movement from a real physical, kind of science. I remember one of a girl that I danced with when I was probably 18 or so. Her father was a physicist, and so he would come and give us these lectures about the physics of movement and things like that. So I was really, just intrigued about the body and movement from an early age.
Yeah, that's awesome. And never thought like a physicist would come across and help you with like dancing, but makes sense. It makes sense.
When you have a daughter, I guess, who does it, right? That's
Right, right. All
yeah.
right. So before we jump more into your story and how you've gotten to where you are right now, what does public health mean to you?
That's a great question. I've been thinking about this since you shared this question with me a little bit ago. My kind of short answer is really, public health is everything. But of course, what do I mean by that? And I think the word, intersectionality, in its broadest and sort of loosest sense of the word, is really how, when I think about public health, it's allowed a lens to understand, not just, personal or, individual or population traits such as race or socioeconomic status, but understanding things from a cellular level, or subcellular level, all the way up to this, macro scale of, laws and human rights and political systems and the environment, the physical environment that we live in, both the built environment and, just the earth and the climate and things like that. And I remember walking into Hopkins, my first few weeks there, and I was like, this is the first time that I felt like I could hold all of those ideas in one space, right? Usually you're studying one thing, right? Which is good. And we need to study, we need to specialize and learn things, in a very maybe narrow lens. But public health, I feel like, allows us to really hold all of that together, and understand how everything is connected.
Absolutely. I really like that definition, going from the cellular all the way to the macro. And yeah, that's one thing you do discover in public health, especially like a master's of public health is like there's so many different things, and the intersectionality of the work and the skills and everything that you're learning is just very broad, which is interesting for a like graduate degree, but it makes sense for public health because as we know, there's just a lot that you can get involved in and do in your public health career.
Absolutely.
Okay, so you started your journey in your collegiate journey, I should say. You got your bachelor's degree in biology at the University of Mary Washington. So tell me, what was the thought process for this?
Sure. So, I will say I started off, I think my declared major when I was a freshman was philosophy. And I really was just, which kind of meant I probably wasn't sure what exactly I wanted to do. I definitely changed my major at least 4 times, mostly because I think maybe I was always a public health person at heart because I just was like interested in everything. I, pursued a little, I did have a minor in psychology. So I ended up taking a lot of courses in psychology and anthropology and sociology. But I kind of always knew I wanted to do something in the healthcare space. I formally did the pre-med, kind of track, but it was through that process realized that I wasn't quite ready to make that kind of commitment to medical school. More of thinking that I wanted to be able to have more time with, if I was going to see patients, I wanted to have more of a therapeutic relationship with them and not necessarily just treating patients every 10 minutes. And so was introduced to the field of physical therapy during college and thought, oh, this is interesting. I didn't really know really what the career entailed and what a broad scope you could have, that you could really, you could work with a variety of populations as a PT. And there was a lot of fluidity to move around versus medical school. You do a residency and then you're kind of stuck in, if you go OBGYN, that's pretty much what you're going to do. I mean, you could become a cardiothoracic surgeon, but that's a big jump, right? Whereas PT really allows a little bit more fluidity, and I appreciated that.
Yeah, that makes a lot of sense. So what was that point in undergrad that you were like, okay, or what was that thing that sparked the reason, okay, I want to go into PT?
Yeah, so I had done some volunteer work in Romania. I had started kind of following the situation there probably when I was in high school, actually, and was kind of put in touch with a charity that was providing care at an orphanage there. And I think I've always had this sort of propensity to say, all right, I want to go there. I'm going to go there and I want to see what's going on, and I want to provide that type of direct service or direct care. And so I did. I had the opportunity to go twice. I was working with a small charity that was UK based, and they would bring in teams of occupational and physical therapists, doctors, teacher, really a kind of a variety of volunteers that would come for, a month at a time usually. And so it was then that I kind of got assigned to work with this group of physical and occupational therapists. And I just loved the work that we were doing. And I felt like even in that short amount of time, we were able to make, a difference and train some of the staff at this orphanage on, how to help children with really pretty severe disabilities. So that kind of piqued my interest. And then when I came back, I spoke with my, kind of biology advisors. And so I was able to get in touch with some local PTs in the United States and volunteered in a school-based setting. And then kind of from there, I think, as I said, I was a dancer. So I was like, okay, let me see what's going on in this outpatient setting, and just kind of starting to volunteer in different places and get some experience. And then finally applied to school.
Yeah, well, thank you for highlighting that. And I think that in itself is important insight to people, like, especially in your undergrad degree, like volunteer. If you find some cool projects, find some ways to get there. There are always opportunities for students to get abroad and do a lot of this work. And like, even from that, you're able to say, okay, this PT stuff, because I'm guessing that you probably went across there thinking more about the medical side of things. Maybe, I don't know, that's just my perspective that I'm pushing onto you. And then you can tell me if I'm wrong or not. and then from just going there and just seeing the other experiences, it made you realize, oh, there's something here that I can do. And then you come back to the US, and then you pursue that even more, and decided that you want to continue your education in that, which I think is a great insight and takeaway for other students, who are listening to this.
Absolutely. I think one thing I'll also mention, I came back with, obviously it was a profound experience, but I also just felt like I'm just an undergrad. I really, that experience was very much for me. I mean, not that I didn't do it something good necessarily, but I felt like I needed more skills. If I was really going to work in this global health space, I wanted to have real practical skills that could be more tangible. And not to discourage undergrads from doing that, but I think having that awareness is important too. That you benefit even just from that experience as much as you might touch a child's life or an individual's life when you do some of those types of trips.
Yeah, absolutely. So you graduated from your undergraduate, and then you decided to pursue your doctor of physical therapy. Okay, so you got your Master's of Science and your Doctor of Physical Therapy at the University of California, San Francisco. How does that work out exactly?
Yeah. So at that time, physical therapy education was sort of in this transitional state where now, for the most part, now most programs are entry-level doctoral programs. But at that time, the doctoral aspect was sort of emerging. So UCSF offered a master's program with then sort of an additional doctoral year, but you could become licensed after receiving your master's degree. So there's very few people that do that now. Like I said, most people are kind of funneling just directly into a doctoral program. But it was kind of a nice place for me at that time because I was able to get licensed. I did do a fellowship during my doctoral studies, but I could also start working part-time. So I was able to actually make a little money and have some practical experience while I was finishing up the doctoral program.
Okay, that is awesome, and yeah, that is also something that people should think about. Like, is this program something that's going to allow me to work part time and give me that flexibility as well? I'm guessing it also gave you the opportunity to do a lot of that work, and we're going to talk about that fellowship in a just a bit. But do you think, like, as you said, a lot of people don't do this path right now of Master of Science and Doctor of Physical Therapy? Do you think that was beneficial to your journey and your learning process?
Absolutely. I think obviously just the training in general and, having a clinical degree and a license and being able to practice you know, was my end goal. But studying at UCSF specifically was really great for me because it was, our program was really rooted in, it's a health professions university. So we were exposed to, and got to work alongside with medical students and pharmacy students and dental students. And I think as you're, kind of painting this picture, that I really like having that type of variety. I don't like to just be settled in one, obviously I was rooted in the PT program, but having that exposure and the opportunity to work with other professionals, interdisciplinary, was really important for me and really continues to be important for me today.
Yeah, and I think that that's important, especially people in public health, because we work across sectors, and just understanding what other people are doing, especially in health related sectors, is very helpful and useful. And it helps you to think about how someone else might be approaching an issue or a problem, and really brainstorming with them to work out how you all can combine your different perspectives to really get a more holistic approach to those issues. So during your DPT schooling, you became a physical therapist slash clinical fellow for the pediatric and adult critical care at UC San Fran. So how do you get that? Was that like just regularly through school? And then what exactly does that fellowship entail?
Yeah, so like I said, at that time it was this master's doctorate program. So the fellowship was a little bit like now, if there's any PT students listening to this, it would be a little bit kind of like a residency, though still not quite what PT residencies are, but it was kind of I think the early steps towards something like that. And so it was really a mentored time in a and you could choose acute care or orthopedics or a variety of different things. I chose acute care because I sort of had that uh, passion towards wanting to understand medicine, even though I didn't go to medical school, but just really wanting to be able to root myself really firmly in medical education and kind of the health system. So even though I wasn't sure that I'd do acute care for the rest of my life, I felt like this will be really great education and experience to kind of lay the groundwork for things I may do in the future. So it was a great experience. I was able, really exposed to a lot of different types of patients and diseases and things like that. And then that led to, once I completed that fellowship, which was several months, they hired me. So that was great too. So they hired me as a per diem therapist. So I was able to work there as I finished up my degree.
Okay, that's awesome. And yeah, always getting opportunities that allow you to go into like a full-time position is always a huge bonus. So I appreciate you sharing that. Were there any other takeaways that you had during your Masters of Science, DPT, scholastic time?
Um, so I'll say, I mean, you're probably getting there in terms of my career journey, but I came to PT school with having had this really profound experience in Romania and really knowing that I wanted to do some type of global health work. And so that was always in my mind through those 3 years of schooling. I just felt like, okay, now, I want to finish, and obviously I want to be a good clinician, but I really want to pursue global health work. And there wasn't a lot of opportunities at that time. I mean, there still aren't, but there are more now. But I wasn't encouraged. I'll say that. I had a lot of mentors who I respected deeply, but they were very much just more traditional, and felt like, what, you need to work in the United States, you need to get that full-time job and work for 3 years, and then maybe you can do this. And that's probably true for some people, but I just was very agitated and felt like, no, I've been working long enough, and I really want to pursue something in global health, which is within a couple of years, I did just that.
Okay, that's awesome, and I look forward to getting more into that a little bit later on. So as you were saying, you got your first full-time job after you graduated, well, during your program, and then after while you graduated, as a physical therapist at UC San Fran. How long did you work there for?
I was there for well, between the fellowship and then working, probably about 2 years.
Okay. And then after that, you got another physical therapist position at comprehensive inpatient rehabilitation at Shands Rehab Hospital. So how do you come across this one?
Yeah, so that was actually a few years later. So I had, after I completed my doctoral year, I worked for about a year. And then I actually went and moved to the Democratic Republic of Congo. So I lived and worked there for a couple of years. And then when I came back in 2011, have to think for a minute, I ended up moving to Florida. And so I was based at the University of Florida Medical Center there. So I worked there for a couple of years. And then I moved again. So I know it's hard to keep track. You need a map to go along with this podcast today.
That's absolutely fine. Absolutely fine. So did you do the work that you're doing in the Congo? Was that DPT related?
Yeah, so it was, so I had met a physical therapist who was also based in San Francisco, and we kind of clicked over just our interest in global health. She had done some work in Ethiopia and had just become familiar with this hospital in the DR Congo. And I think she had been there one time, and she was in the process of raising some funds to go. Initially, we'd planned to go for 6 months, but she needed some help with the project. This was a hospital that had been supported by a nonprofit, mostly from like a medical and nursing perspective, but they specifically asked for physical therapy training. They were starting a new program called the Orthopedic Officer Program, which is kind of like a mid-level provider, or I know some people don't like that language, but kind of the equivalent of a nurse practitioner or physician assistant type of a program. But essentially these were, level 3 nurses, so, well-trained, experienced nurses that were getting some level of surgical skills training and then some level of physical therapy training. And it was a brand new program that they were starting at the hospital. So that was really the focus. Of course, once we got there, we really did help to build up their whole PT program. And, I think once you're there, just the work kind of exploded in terms of community-based care, hospital-based care, just doing a variety of different things. But that was the focus.
Okay, that makes a lot of sense. Okay, so I want to ask you a question, but before I ask you that, just in case someone listening to this has no clue what a physical therapist does, which I it's hard to say that they don't know that, but if they didn't, what would you say a physical therapist does?
Yeah, that's a great question. And you're right. I think everyone has their idea in their head of what a physical therapist, if you watch sports, right, it's the person, that's helping to rehab those athletes, to get them back on the field. Or, maybe you are familiar in the context of geriatrics or something like that. But really, I mean, we're essentially the movement specialists of the healthcare field. We can really do a variety of things, from prevention and wellness to obviously providing, direct rehabilitation care in the context of severe injury or illness. But our focus is primarily on function. So whatever function means to someone, it could be helping a child learn how to play on the playground, to helping an adult get to the bathroom and back safely, to helping that athlete get back to their sport. So we can really nest ourselves in a variety of different settings, depending on interest and need and things like that.
Okay, well, thank you for sharing that. And did you have like a certain interest in the physical therapy world when you were like practicing, or was there an ideal that you would ideal like population, or type of clientele that you were trying to work with?
Yeah, so early in my career, I did a lot of pediatrics. So I worked with little kids, and then also kind of was neurologic, like focused on the neurologic population. So I did care in the ICU and kind of intensive rehab after like a stroke or brain injury, or some kind of complex orthopedic trauma. I felt like I was pretty skilled at kind of crisis management and really helping those types of complex injuries. And I did quite a bit of that even in my time in Congo. It was also my time there that in DRC that I was exposed to women's health. And so I started having a burgeoning interest in women's health. Was experiencing a little bit of burnout too, to be honest, in terms of treating pretty complex cases, particularly pediatric cases. And so was kind of wanting to shift my clinical focus to learn a little bit more about women's health. So for the last 6 or 7 years, I've been predominantly focused on women's health and pelvic health conditions.
Okay, and what was it in the DRC that made you focus on women's health, or like that catapulted it to the front of your mind, or something that you wanted to pursue more of?
Right. So two things kind of that happened at the same time. One, the staff needed some training to work with a population of women who were suffering from a gynecologic injury called fistula, or obstetric fistula. And I, at the time, and from what my training was in PT school, I didn't really know a lot about that injury or about pelvic health. And so I met a colleague, or kind of put a plea out into the world to ask for some help for handling that diagnosis. But as I would listen to women's stories, and I would often treat their children, right? If they had a child that was coming in with a disability, I would listen to these women's stories and start to think about, gosh, if we just provided better maternal care, maybe, we would have better outcomes for our kids. And so I think that public health seed was kind of planted there, where I just kept thinking, how do we get back to the source to fix this problem going forward? So that was happening. And then, like I said, this kind of need for fistula care was also happening. And so I think both of those kind of pushed me in this direction.
Okay, that makes a lot of sense. And yeah, like as you delved more into it, it seemed like you saw, okay, there are a lot of the prevention aspects that could be put more into place to really prevent a lot of the things that you were helping people with throughout that. And I think that's the case for a lot of people in public health, or just generally just dealing with the issue and then realizing that there's something like rooted that could be changed to like improve or like change, so that we don't have to deal with this issue or at least not at this scale. So I think that's some great insights. Were you going to say something?
No,
Okay.
that's exactly it.
Okay, awesome. So, okay, you came back, you started working at Shands Rehab Hospital, and then after that, you switched across to still in Gainesville, the Pediatric and Adult Critical Care at Shands Medical Center at University of Florida. So, how do you come across this, and was this work a lot different from the previous physical therapist job that you had?
It was it was pretty similar, a little bit more focused on, and so I kind of bundle that work kind of because it was really through the same institution, but just kind of floating between two different hospitals. I did get quite high quality training in what's called comprehensive inpatient rehab. So that's providing a little more intensive therapy. So someone is maybe out of the ICU, but then they go and they have like 6 weeks of really intensive therapy for, to get them home again, essentially. So that was a wonderful experience. It was in North Central Florida, so University of Florida provides services to really even like Southern Georgia and kind of that whole region, which tends to be low income, some low education or low literacy. So in an interesting way, I felt like my time in Congo had really prepared me, to some extent, obviously very different scenarios, but to work with a population that maybe didn't have, the best health literacy, and to be able to help explain to them what was going on, or rehabilitate them.
And that makes a lot of sense. And I like that you highlight that even though it's like a completely different country, continent in general, the lessons that you learn from there was still helpful and transferable to a similar population, or a population that's dealing with the similar types of barriers and access issues that were there. And I think that's important for people to also understand, that a lot of our experiences we can pull from and use that to in our new knowledge and new ways of doing things. So I appreciate you sharing that. And a little bit earlier, you said that when you were doing some of your PT work, you found out, or you like realized there was some more root cause, and then you're like, okay, this is more public health work. When did you find out about the word public health, the field of public health, and all of that?
Yeah, so I really didn't know, the term public health. It wasn't something we didn't have a class on it in our PT training. There was no option for that in my undergrad. And it was actually while I was living in Congo, and we had an MPH student from Hopkins who was, I think she was either a medical student or had just finished medical school, and was doing a year-long MPH. And so she came to do some, research on orthopedic trauma, and we just became friends. And I was kind of her mentor, in terms of that research project. But I just thought, tell me more about what you're learning in your program. And I was just fascinated. And I thought, gosh, why didn't I know about this? I want to get a public health degree. And so really from that time, I knew I was going to do an MPH. It was really a matter of timing, figuring out the best time. Obviously it's costly, things like that. So from that moment, I knew, there was something there that I wanted to pursue. Yeah.
Okay, well, thank you for sharing that. And I feel like I've heard a lot of people say that, like they've gone on like volunteer experiences abroad, or like doing some work abroad, and they have like other people that are doing work, and those people have MPHs, and they're like, oh, that's something that I can look into, and then they find out about public health and they dig more into it. So I like exposure, I think, is like a huge part of public health, especially like before the pandemic. No one knew what public health was.
Right.
And still
So
now,
true.
I'm guessing there's a lot very misunderstood still, but regardless, like it's just good to get that exposure and like to your I guess to your benefit, you were able to take that experience and then take away the learnings from that as well, which is awesome. Um,
Yeah.
so then after UF, you became a program manager at Global Strategies in India. So what was your process for finding this job?
Yeah, so Global Strategies was the nonprofit that I worked with when I went to Congo. So
Okay.
they helped kind of support that work, and even while I was in Florida, they did send me back to Congo, I think twice for about a month to do some training. So I'll say that I always, whenever I took a job, it was always with this understanding that like, well, I'm only gonna, I'll do my best when I'm here, but you have to let me do this global health work because it's really where my heart is. And I've been fortunate to have great, managers and bosses that allowed for that. So Global Strategies, we had been, kind of had this nice relationship for several years. I was kind of nearing the end of my time in Florida, and again, kind of thinking about this MPH, but they had reached out to say that there was a need for some physical therapy programming in India. So it was another. They work in about 3 or 4 different countries, so they're not a huge nonprofit, but they had an ongoing program in India. And so they asked if I would be interested in going for a few months to try to do some training on community-based rehabilitation and really kind of, well, maternal and child health. So focused a lot on pediatrics, but also on, working with pregnant women and postpartum women. So I said yes, and and went out there for a few months before then landing back in Baltimore and getting into the MPH program.
Okay, awesome. So what's that conversation like between you and your boss to say, okay, like I love this job, like I'm doing this job, but like global health is where my heart is. How do you have that conversation to say like if these kind of opportunities open up, I'm going to take them and like just have yeah, tell me more about that.
Yeah, that's I well, I'm not, I wouldn't say I'm the best negotiator when it comes to many things, but that was always just a deal breaker for me. And I think, I mean, I did work really hard and made sure that I was, a good employee, a good clinician, certainly while I was there. And I think for the most part, people are supportive of this type of work, even if they don't fully understand exactly why I want to go do it or what exactly I'm doing. There's usually some support, or whether it's a, kind of a philanthropic side of things where they want to, be able to support their employee to go and do this type of work. So fortunately, it's always been, you know, yeah, I felt like I've always felt like I've had that kind of, support from bosses.
Okay, okay, well that's good. And yeah, that's I'm guessing a lot of people that might be something that they want to do, and just having that type of conversation is not the easiest, or it's not the first thing that people think of. They might shy away from it. So I think you just sharing that that was something that you did, and you were like passionate about this, and this was something that you wanted to do, and being able to do it, I think is helpful for other people to see that okay, it is possible. I just need to like be a little more proactive in my conversations with my boss and my supervisor around this. And as you said, a lot of them are receptive to it, even if they don't fully understand it, which I think is great as well.
Yeah.
So you said after from India, you came back to Baltimore. Baltimore, am I saying that right? I don't know. It
Yeah, you
sounds like
got
I'm saying it.
it.
I don't know why it sounds like I'm saying it weird. So you came back as a consultant at EngenderHealth / Harvard Humanitarian Initiative. So what's that process like for you? Like going abroad and then like coming back and finding a position. Was that tough for you?
Yeah, well, so that was an interesting year for me. So I was in India for several months, and I came back, and I hadn't quite settled into a job at Hopkins yet. I was kind of in the throes of, sending in my resume and, going through all of that process. But while I was in India, my colleague and longtime friend, Jessica McKinney, she was the one who kind of helped to provide support for the Fistula program when I was first in Congo. And we had always been in touch during this time just to figure out, I think we share a heart for this work. And so she had been at a meeting, or I actually can't even remember how she got in touch with a woman from the Harvard Humanitarian Initiative who said, hey, you guys have done some work with women with fistula. We've got this little bit of money. Kind of, they're actually kind of winding down on a project. And you know what, we'd love to send you to, it was a different hospital in Congo, and to kind of do a needs assessment, chat with their team, and you know, see what you think you could do in terms of building a rehab program that's really focused on women's health. So I was so, I'll admit, I was so tired. You know, India was a good experience, but hard and tiring and long. And I was like, really, we're going to get on another plane? And she's like, come on, you got to do this. So I did. So we got on a plane and went for I guess about 2 or 3 weeks, and that was the first time I had visited Pansy Hospital. So that was a different hospital from where I previously worked, but not too far from where I had been before. Also in Eastern Congo. It was a little bit different in that its founder was an OBGYN who specialized in you know, surgery for complex gynecologic injury. He was really responding to the conflict in that area that had been ongoing for a long time. So providing a lot of care in obstetric fistula, but then also you know, working with survivors of sexual violence. And so we were able to meet him and his team, and really, I mean, it was a wonderful experience. And of course, we came back, we wrote this big needs assessment and said, these are all the ways we can help. And they were like, great, we'll be back, you know. And then it was almost 2 years before they circled back. And I think that just speaks to the way funding cycles can go sometimes for these larger projects, where they were just closing out, you know, and I think it was the end of 2013. And then it just took another full year for the next 5 years of funding to kind of come through. So I guess in some ways it was, you know, good in that it gave me time to get going with my MPH and things like that. But yeah.
And did you say what you did with the Harvard Humanitarian Initiative specifically?
Yeah, so they were working with EngenderHealth at that time to support some work in Congo, and so it was really just a needs assessment. So we did like a site assessment, I should say, where we went and we conducted a lot of interviews, obviously like toured the facilities, spent a lot of time with it. They had just a single physical therapist for the whole hospital, so you can imagine so she treats everybody. So we were like, okay, well, how are we gonna build a PT program with one PT. So we went with nursing staff and social workers, spent some time with the surgeons. I mean, some of it was relationship building. Some of it was, trying to figure out actually, how many treatment tables do you have, and, writing and making some lists and things like that, to think about what kind of equipment they might need.
Okay, well, thank you for sharing that. And then earlier you said, I just don't want to miss out on this. You said in India it was very hard, very challenging. What were some of those things that were very hard and challenging working in India?
So my time in India was very different from my time in Congo. And obviously they're two different places. So I don't mean to sound like I would have any, notion that they'd be similar, but I was in kind of a city an urban setting when I was in Congo, and there was, I don't know, just it was a different type of a setting, whereas in India, I was in a very, very rural area that was, really remote. It took an hour to get, to go to a grocery store even, right? I mean, you're like out in the jungle essentially. And so that was remarkable, but just very, different, not that I didn't do any kind of travel in Congo. I did do some travel, but not a lot because of the safety situation. So being in such a quiet place, it was just like a different pace of life, different types of different culture, different types of diagnoses and patients that were coming in. So some of that was challenging. I think it was also a new thing for that particular organization, the Indian organization. It was a little bit new for them to have someone like me coming in and kind of working collaboratively on a program. So we were kind of, just learning, dancing around, trying to figure out, that type of relationship. So it was tough, but I was able to pass it on to, we had a series of volunteers that came through after me. And within about a year, I mean, I will say the positive that came out of that is that their program is still going, and they've really taken it over as, I'm sure that they still have visiting clinicians that come, but they've really owned it. And that, so that's great outcome.
Yeah, that is great. It seems like you were there to really help and support, build the backbone for the organization there. And yeah, I can imagine that being difficult. Even like shifting, as you said, from like a more urban place in DRC to rural India, which I'm guessing comes with a lot of challenges. Like an hour to get food, that's something that some of us think is unheard of. But that's what you did, and kudos for you for doing it. And we appreciate you doing that work. Um, and then after your time at the Harvard Humanitarian Institute, you started as a physical therapist at the Outpatient Women's Health and Orthopedics at Johns Hopkins Hospital. And you did this throughout your MPH as well. But before we get into your MPH, how did you come across this position? And then what did you do?
Yeah, so this one, I think that kind of marks the transition in my clinical career from all the other things I've talked about to really focusing 100% on women's health. So I had been doing, I had quite a varied background, obviously coming into women's health, and had a lot of training in places like Congo, which not it's hard to figure out what the equivalency of that is, to translate into US based work. But it was exciting. And I was really eager to kind of root my career a little bit more in the women's health space, gain some new experiences and things like that. So yeah, it was a great opportunity.
Okay, and then earlier in the interview, you were saying that you wanted to get a master's of public health, but it's expensive and like you need the time and the place. What came together for you to say, okay, I want to do my MPH now?
So I applied at least twice, if not three times, and mostly, and I got accepted, but I was like, oh, I'm not quite ready to, either I had an opportunity to travel, or just financially, I was still kind of reeling from my PT school debt. So I'd gotten the job at Hopkins, and I worked there as a salaried PT full time. I did, and I applied again and thought, okay, I'm living in Baltimore now. Like this, I'm ready to do this. And I was fortunate. I had a lot of support. Again, I've really been fortunate to have a lot of like management, and my bosses have really supported a lot of my other endeavors outside of providing direct clinical care. So when I was accepted into the program, I had wanted to shift, so I wasn't working necessarily 40 hours a week. I wanted to be able to go on campus, since the campus was literally across the street, to take at least some of my classes in person. And so he said, well, let's switch you to what's called a per diem status. So I was kind of, getting hourly wages rather than a salaried position. But I was able to offset some costs with that, and kind of have a more flexible schedule. So I worked about 3 days a week doing clinical care, but then I had 2 days a week where I could go to classes or do homework or keep these other things going with EngenderHealth and stuff like that.
Okay, awesome. Well, thank you for sharing that. So you got your master's of public health at John Hopkins Bloomberg School of Public Health. Um, so was it just that you were in this location and it was the easiest spot for you, so you chose to go to John Hopkins, beside it being like one of the best MP public health schools like in the world? Was there anything else that kind of drove you to the school?
Um, well, besides that, I mean, certainly location. And, I was, after all the travel I had been doing, I was kind of happy to be back in Baltimore. I had family there. And so I was like, okay, I'm going to be here for a few years. I had the opportunity to keep working at Hopkins Hospital. And I had mentioned the MPH slash medical student that I had met in Congo all those years before, and she had only good things to say about the program at Hopkins. And so I did look at a few others. But kind of like with PT school, I only ever applied to one school, and then I thought, well, if this doesn't work out, I'll move on. And fortunately, I was able to get accepted, and just jump right in. So it was a great opportunity.
Okay, awesome. And did you have a concentration?
I did, and I really have to thank my advisor, because I think, as you can tell, I have a lot of interest, and I'm like, I want to learn everything about everything, right? Which obviously is impossible. So he really encouraged me to pick a concentration like maternal and child health or something like that. So I picked the MCH concentration, and I think it was great, and it really did help focus me. Otherwise, you look at the course catalog and you can get lost there. And so I did take some other electives and things like that, but I felt like it served me very well in my career since then. It obviously was right up my alley in terms of I had already been kind of working in that space, so it kind of solidified some of my experiences and knowledge in maternal and child health. So it was great. If I had a chance, though, I might go back and do a different concentration again.
Fair enough, fair enough. And then while you were doing your MPH, you were still working, as you said, as a physical therapist. But then I also have that you were a consultant at EngenderHealth, the Fistula Care Plus, and this was in Nigeria. So what was that process like? And then what did you do?
Yeah, so there's kind of like two things going on, right? So I'd had always had my clinical practice going on, but then I kind of always had these other consulting or global health kind of work going on at the same time. So EngenderHealth had supported with Harvard Humanitarian Initiative. They had supported that first kind of site assessment that we had done in 2013. So this Fistula Care Plus program was the second round of 5 years of funding from USAID. So the first round was Fistula Care, and so that was what that kind of first bit of work was. So they finally dug up that site assessment we had done and reached out to us. And well, I think they reached out to us, and we kind of pursued them a little bit too, to say, hey, what happened? Don't forget about rehab. Rehab's important for women with fistula, and we think we can, help scale up some of your program. So that was a wonderful opportunity. The director of that program at that time was also a physician and surgeon who had done a lot of work with women with fistula and really appreciated the need for rehabilitation, as well as my and my colleagues' experience to up to that point. So they had several sites they were working with, but they had two sites. So the site in Congo, so Panzi Hospital was one of their main sites, but also this hospital in Nigeria. So we provided support, worked with, again, kind of really focused on capacity building and providing educational materials, helping them with research and things like that, to be able to kind of standardize physical therapy care for women with fistula.
Yeah, that makes a lot of sense. And yeah, I'm glad that they dug up your report and then used that for the other 5 years of funding to do that type of important work as well. And also, while you were in your MPH, you started your own private practice. Is that what happened?
I did,
yeah,
because I didn't have enough going on. No, it was a very tiny private practice. I had a friend who ran a wellness center, and actually it started by her having a single client who she said, I really think this person needs PT, but they don't want to come in to Hopkins. I would love for you to come in, see if you can work with this person. And I was like, okay, I'll do that. So I scheduled it on a weekend, and then it turned out, I felt like I could help this person, and we kind of hit it off in terms of a therapist-patient relationship, and so I kept seeing him for on a weekly basis, and then from there it would be like, hey, I have this other person, so it kind of slowly would built up a small practice that way. So it was nice. It was I didn't deal with insurance or anything. It was just like a kind of more casual type of a practice. Hopkins was very busy and a lot of paperwork and things like that. So it's nice to have kind of a side practice that was, patients that were a little less acute, less case management, and things like that involved, and just really being able to be a clinician.
Okay, so you were doing your MPH while working at Hopkins, still while doing your private practice.
Yeah.
So I guess my next question is how did you balance that or how did you get through all of that?
I'm not sure, to be honest. It's funny, I look back and I think, oh my gosh, how did I do that? I would never do it now. But I had a lot of energy, and I was the work that I do abroad, the MPH even, I mean, granted it's a lot of work, but it didn't feel like a lot of work because I enjoyed a lot of it. And same with patient care. I enjoyed what I was doing, even though I certainly was tired at times. I also knew there was an end in sight, right? I knew I was going to finish my degree. I knew after that I would probably have some shifts in my career. I did stay at Hopkins for another year after, but was kind of slowly backing away from so much clinical care and trying to really build up my public health work.
Awesome. And were there any other takeaways that you had from your MPH program?
I guess, and maybe this is kind of a theme across the board, but just like not being afraid to go after whatever opportunity comes up. If it's something that you feel like you know that you want to pursue, or at least want to, have a seat at the table, keep kind of nagging at someone until they, look at you and say, hey, what do you have to say? So
Yeah, I think that's important insights. So thank you for sharing that as well. So you said you graduated from your MPH, you worked for Hopkins for a little bit, and then you became the co-founder of Mama LLC. So well, first of all, tell me what Mama LLC is.
Sure. So it's a small partnership with my colleague Jessica, who I've mentioned a couple of times here. So she and I had been kind of doing this work in pieces. She lives up in Boston and is also a clinician, a physical therapist. So we, would just kind of have phone calls in the evenings and weekends, and we'd put together, or we work on some of our consulting work with Engender. But we had we were getting contracts with EngenderHealth kind of on a pretty regular basis for different projects. And so we thought, rather than being two independent consultants, maybe we could come together and form a partnership, and then maybe even find other people to, who want to hire us for work. We toyed around with the idea of a nonprofit, but honestly, for everything we had going on, that just felt like something that would have slowed us down. We were wanting to be a little bit more nimble, and work with nonprofits, but maybe just kind of throw us in there as a line item, and we certainly have varying rates for nonprofits versus for-profit companies and things like that. So from there, it really, we'd start off with that one contract with EngenderHealth, but then started to pull in a little bit of other work domestically as well. And it was really an opportunity to say, we've got this expertise in women's health. I have this public health degree, which has really given me, kind of rounded out my education and experience in research and advocacy and even education. And so we've kind of slowly been defining our LLC for the last few years. And yeah, it's been a fun and interesting process for sure.
Okay, that's awesome, and that's awesome that Jessica Mackery, is that the
McKinney.
McKinney.
Uh-huh.
I spelled it incorrectly in my paper. Yeah.
That's okay.
But yeah, it's awesome that like you all have that relationship and then continue to like grow as friends as in that relationship, and understand, okay, there's this opportunity for us to like come together and collaborate and create this entity to do the same type of work that we're doing, but just like collectively to make it easier on both of us. And I think that's great for other people to hear, because it's not like you said, okay, let me find out how to do this. It was like, okay, this opportunity is here, and I have this person that I know that I like working with, that has similar ideals and values that I have. Let's start this. And one thing again that I like that you said, like a lot of people think, especially in this public health work, that you have to start a nonprofit a lot of the times, and I don't think that is the case a lot of the times. I think, like as you said, the LLC, you're able to be a lot more nimble. You're not able to get like grant funding in a lot of cases, but I think there's a lot of other barriers and a lot of other things that come with nonprofits that people don't think about, that they don't talk about enough. So I'm just happy when people like share like their experiences to understand that, okay, an LLC is something that I can do, and it could still have this positive effect on people. Like I don't have to have a nonprofit to have a positive effect on people, which is sometimes the only thing that people in public health are thinking.
Right. Well, and you can be, we had an opportunity with Renovia, who I actually do work for them now as an employee, but for almost 4 years, I consulted with them, and they're a for-profit company. But I was still felt like I was leveraging the same types of expertise as I would leverage for a nonprofit, but I was able to, make a little bit more money because of their status. And then that really offset and allowed us to support our colleagues at Pansy Hospital, for example, or, to be able to do some of the global health work that otherwise we were just, scraping together funding from, various sources or even our own pockets. So it was helpful, for us. It made a lot of sense for us. And maybe one day we'll consider the nonprofit route, as well. But I think there's multiple ways to do it for sure.
Yeah. And I work with like a lot of organizations that both have like a for-profit and then they have the non-profit arm. And I think that that's also like a good model that people don't talk about enough as well. Um,
Absolutely.
how has Mamo LLC evolved over this time period? Like you said, it started with that one contract with EngenderHealth, and then like how has that evolved?
So it's been slow, right? Because we both kind of had these other things going. But I feel like we've, each year we kind of are building our kind of business identity, and like, oh, that, yeah, I think something that we probably both struggle with, we're very much kind of worker bees in some ways, and thinking about messaging and sort of the marketing side of things is neither of our strong suits necessarily. So being able to find the words to explain what it is that we do to potential clients or partners has taken some time. I think we've landed on something good in the last year or two, but early on it was like, oh yeah, we need a website, what are we going to put on it, and really just kind of a grassroots kind of effort. I'm happy to say EngenderHealth has continued to contract with us. We have a new contract with them. All of the Fistula Care and Fistula Care Plus projects have been closed out, but there's a new USAID funded project called Momentum. So we'll be a part of that. So that's really exciting. We've gotten a chance to work with a few other, educational institutions. As I said, Renovia, we were working with them right up until last year when they recruited me to convince me to join full time. So up until then, they were one of our big clients as well.
Okay. And who are your ideal customers or clients that you all try to work with?
So really, could be really be a variety of things that anywhere that someone needs content expertise in the space of women's health and pelvic health, we can provide that. We do also do a lot of advocacy work, and I would say one of the big focuses is on education, and whether it's education that's consumer facing or patient facing, or clinical education for a team of healthcare providers, and we're able to do that both here in the U.S. and kind of gear things towards a U.S. based audience, as well as our experience working primarily in sub-Saharan Africa, but certainly in other parts of the world as well.
Okay, that's awesome. And are there any like learnings that you think you would be valuable to share with other people that might be thinking about starting their own either for-profit or non-profit around like social good, helping people type of stuff?
Let me think about that. I mean, I think I wouldn't call myself a risk taker globally, but I'm a calculated risk taker, right? Like any good public health person, right? And I think weighing out what you have to lose versus what you have to gain, and being able to try, we could have kept going as independent contractors, and that would have had its own benefits and or pros and cons, I should say. But it's been a real learning experience just to Jessica and I do have a deep friendship as well, and we've been longtime colleagues for 10 years. So we're very lucky to have that. But so I feel like that type of communicating, coming into this from a place of real open communication and shared values and shared vision has been crucial. But I think, so just kind of being, I guess, discerning about, who you want to partner with and things like that, certainly important.
Yeah, that is important. People can make or break like your partnerships, your organization, your business. So that is definitely very, very important. Um, so you also currently work as a senior manager of medical affairs at Renovia Incorporated, and you said that they had contracts with you all, and then they kind of recruited you. So what was that process like?
Yeah, so I've been working with them for, gosh, like I said, almost 4 years. So it's a medical device company that produces a digital therapeutic. So it's sort of a piece of technology and a smartphone app that's geared towards female pelvic floor disorders, specifically treating urinary incontinence. And so I had been working on a variety of things, like giving them some generating content that was kind of patient facing, about pelvic health, fun facts and things like that. I had worked on some research and writing with them, helping them to develop research protocols and things like that. Early on, worked with their engineering team, even on like product development. So really, in a lot of ways, leveraging my clinical expertise and anatomy types of expertise to kind of work with their team. And I really enjoyed a lot of that. It was when I was learning a lot. It's a startup, so I was kind of just fascinated by, most of my work really had been in the nonprofit space. I was like, wow, this is how the money gets made and how things get, traded around and, things get pitched. And just kind of watching a business evolve has been really interesting. Something I didn't expect that I would find myself in, but it's been quite a learning experience for sure. So last year, so during the pandemic, obviously many of us, had lost our jobs or had some kind of loss of income. And I was part of that as well, and really was in need of something a little bit more steady. So when they offered me full-time position, I decided to jump on it. I had a nice experience with them up to that point, and was, happy to join their team to continue to build this product.
Okay. How was that hopping into the startup realm? What were the challenges there for you? Or the barriers or whatever you had to lay into like be successful in this role that you're doing right now?
Yeah, it's a very, working, like I said, mostly I'd worked with nonprofits or even in academic institutions. So just working with the business world, it just is very different. The people kind of operate and think and even talk differently. I mean, just like the vocabulary is a little bit different. So I kind of felt like I was learning a new language in some respects, just like, oh, that's what they mean when they say, this or these acronyms, floating around, which I'm sure people feel the same way when they come to, a nonprofit meeting or something like that. But so that's been, really interesting. And really even having this type of insight into healthcare in the United States, and how, for good or bad, I think just understanding how healthcare is provided, how new technologies come to market, who gets a say and a seat at the table in those conversations is quite interesting.
Yeah, and it's something that I feel like they don't teach us a lot about in our MPH programs, but it is like a huge field, and there's a lot of that going on, especially I think in the health tech, digital tech space right now. There's a lot more pushes for that, and a lot of the bigger organizations out there are pushing a lot into healthcare. If you're looking at like Amazon, Apple, and all of those, I'm not going to be very surprised if they do take a lot more share in the healthcare space in the next decade or so.
Absolutely. Yeah. And so it's important that people like us and with the clinical background and or MPH, are there to say, this is to kind of steer the ship a little bit.
Yeah, absolutely. Because tech people have great ideas, but they sometimes don't have all the skill sets or understanding of the systems levels or the things that they need going on for to have the type of impact that they want to do. So that's why I think like the MPH is such a valuable degree, and you get a lot of skill sets that you can translate to these fields to be helpful to a lot of different types of organizations.
Absolutely, I agree.
And what do you do specifically as a senior manager of medical affairs?
So the work is very similar to what I did as a consultant, just more of it. So I've done like some of the big projects I worked on in the last year. I worked a lot on our app, so developing our app to provide kind of appropriate health literacy, level educational content related to pelvic floor issues and urinary incontinence, and since that's what the device is designed to treat. So that was a big project. Also working on things like medical animation videos and, kind of writing scripts and working with animators and things like that. So that's been an interesting aspect of the job. Working a lot on research as well. So we are, have conducted a series of trials and things like that. So helping to inform, data collection and just research design and things like that, and manuscript preparation. And then I do provide a little bit of kind of support for providers in the community that might have questions about either our device or just the disease state and itself. So we do like medical education types of events and things like that.
Okay, okay. Well, thank you for sharing that as well. And I had another question that just came up in my head. So you co-founded Mama LLC. Do you think you would have co-founded this if you didn't get your MPH, or do you think like the MPH with the physical therapy was something that kind of like led you down to starting this?
That's a great question. So my colleague Jessica was, she always had this idea of, well, she always loved the word mama. She's like, I think we should, call our company or our business, mama. And so we had kind of talked about it, more on, as on the side, not as like I'm not really quite sure when it became a real concept that was like, oh, we're actually going to do this. So I don't know. I mean, part of me wants to say no. I do think that the MPH really, one, I learned a ton, but also just gained a lot of confidence in that time. Maybe it was a combination of where I was at in terms of my clinical career. I was about 7 or 8 years in, and so I was starting to feel confident. At kind of that point in my career as a physical therapist. But I don't know. I feel like the MPH really did open a lot of doors for me, or like I said, really made me feel more, confident in approaching, these contracts with EngenderHealth, for example, knowing that I had skills, like, oh, I took a class on that. I know about the FDA, for example, in terms of Renovia, things like that.
Okay, okay, and that makes sense. I appreciate you sharing that. So before I move you on to the Furious Five questions I ask all guests, I would like to ask, where would you like to see yourself in the future?
That's a great question. It's been hard to imagine the future. I feel like we've all been in this pandemic
Mhm.
cloud, and only recently have I felt like we can start to dream again, right? Or at least for me personally. So I will say something I've learned about myself is that I love to build things. I like to be in at the early stages of things and create, whether it's a product or a project or something like that. And so I look forward to having more opportunities to do that, going forward. I am pursuing a kind of relationship with UCSF since I'm back in the Bay Area. So I am hoping to, be able to teach a little bit more. So I would love that, but I don't know that I'll pursue a full-time faculty position, next year necessarily. But I do love teaching and educating, students and stuff. So I could see that being in my future as well.
Okay, well, we will look forward to seeing where you do end up and what you do end up pursuing in the future. But I think like your idea of like being in that startup stage of creating something is really cool, and it's cool. I think to just shape a product or a service that's going to be out there to be helpful to people. So good luck, and we'll be following along the journey as well.
Thank you.
You're most welcome. Okay, so moving on to the Curious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Um, the Furious Five got me. I was like, I feel like I need to put my game face on now. Um, so advice, I think something that I've always done and even look to now at this stage in my career is finding a mentor or a few mentors. Someone that's either doing something like what you want to do, maybe doing exactly what you want to do, or has a knowledge or skill set that you respect deeply. I think having people, that you can align with, whether that's a formal mentorship, that's someone that you're meeting with regularly, or someone that you just have a, one-off conversation or a couple of conversations with. But I think that's really helped me a lot in my career and given me a lot of encouragement along the way as well.
Okay, I think that's great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Um, I think so. I do feel like a lot of what's gotten me where I am is a lot of determination. I've always been very kind of goal oriented, and even if I don't quite know the path, I can kind of see some hazy image of what that will look like, whether it's in a year or 5 years. And I think you know being a little bit unwavering in that determination, I think is helpful.
I like that too. Number three, what's something you're working on improving in your life right now?
question. Um, so I'm not one to make a lot of New Year's resolutions, but I did make one this year. I realized over those last couple of years, I've been reading a lot, but mostly reading academic articles and news. And I had kind of lost, reading books, hard copy or paperback books. And so I have a concerted effort to put the computer and the screens down and to really dive into some books, maybe slightly less academic, to give my brain a rest or think about something different.
Yeah. We support reading here. I'm always adding books to my book list. And number 4, professionally, do you recommend anything?
In terms of like books or anything or
anything. You say books. I know you already mentioned mentorship, so maybe a book or anything else that you think was helpful to you or would be helpful to any other students or professionals.
Sure. Well, a couple of books come to mind in terms of public health. Well, obviously, in the wake of Paul Farmer's passing, I would be remiss not to mention his he has a series of books. What was really impactful for me was Mountains Beyond Mountains. I read that early on before I even did an MPH, and have followed his work as well. There was another book by Michael Van Rooyen, who actually started the Harvard Humanitarian Initiative, called The World's Emergency Room. I was listening to that on Audible while I was doing my MPH, and that resonated with me a lot. One, everything he was talking about in terms of how he was tackling the public health problems he was talking about. He also happened to work at the facility that I had been working at in Congo, so there was a real, kind of personal attachment there. But both of those books were really, really formative. I listened to a series of podcasts, but I have to say I'm not one that follows what I kind of jump around, so there's not one that comes to mind. I tend to be all over the place with podcasts.
Yeah, those books are great recommendations, and I'll add them to my ever-growing book list. So thank you. I appreciate that. And then number 5, last but not least, where can people connect with you?
Sure. So I'm on LinkedIn probably most often. I'm happy for people to connect with me there. We do have our Mama LLC has a website that's www.themamas.world, and there's a contact us page through that. So that's primarily. I am on Instagram and some of the other social media platforms, but much less frequently. So.
Yeah, that's absolutely fine. So thank you for sharing those. I'll definitely put those in the description as well as the show notes. People can check that out, and I'll reach out to you and connect with you if they feel to. But thank you so much for taking time today to come on and chat more about your public health and doctor of physical therapy experience and how you're combining that clinical and public health work to do the things that you're doing today. Is definitely helpful to a lot of people out there. So I appreciate the conversation.
Thank you. It was fun. I enjoyed it.
My pleasure. So housekeeping items, everyone. Be sure to subscribe if you have not subscribed as yet. Be sure to leave a like if you're watching this on YouTube. Leave a review, hopefully a 5-star review, and let me know what you think about the show. Share with a friend. That way it gets out to more people, and people can navigate their public health career just a little bit better. And if you want to support, you can go to thephmillennial.com/support and support there. But thank you all for tuning in today.